right now? Is there that influx quite yet?
Yeah, definitely. I would say the unit's been open for about a week, and they're almost at max capacity as of today. Not everybody stays. You know, obviously they come in to be ruled out, and then if they're ruled out, then they move off the floor to make room for somebody else. But right now, yeah, we're almost full, so it's definitely happening, I would say.
And so when these patients come in, what are the symptoms? I guess I know we've heard the cough, the fever, but I don't think people quite realize what that cough is.
So in the patients that I've seen so far, I mean, it just kind of depends on, you know, their underlying issues and the severity of where, you know, where they are in their illness. Sometimes it just sounds like a regular cough, like maybe someone would just have as a cold. I've had patients where when they get up and walk, it can induce it, they're more short of breath and they kind of like are catching their breath, kind of a cough. Sometimes it's more of a productive cough. It really just kind of depends on, you know, how severe their illness is and what underlying conditions they have that go along with it.
And, you know, we're seeing right now the, you know, shortage of face masks, the shortage of ventilators and beds and stuff. You know, I guess, what is your take on that right now as we're kind of, I believe we're just kind of at the beginning of this surge?
Yeah, so I think we've done a lot as far as kind of preparing for that, because I think we knew going into it that we potentially could have an issue with the shortage. But we've come up with some really innovative ways to be able to reuse masks and extend their life in a safe way. I think they've said before, we have that UV light that we use to kind of, they treat the masks after we wear them and then we're able to rewear them. And they said that it doesn't disintegrate or damage the masks anyway, so we're able to redo that a couple of times. Whereas I think originally they thought maybe over time it would degrade by having the light treatment, but it sounds like, at least as far as we know, the light treatment doesn't degrade the masks, and so we're able to reuse those more, which is good. We are trying to be cognizant about how often we go into a room and things like that, so we don't have to put on masks unnecessarily. So we try to group cares as much as we can, limit exposure as much as we can, both for our safety and to conserve PPE. And then we are using our gowns that are reusable, which is helpful because in the beginning we were using disposable gowns, but these are laundered through the hospital, and so we're able to reuse those, which is great as well.
And then, you know, you're a nurse. Do you have a family at home?
I do, yep.
So how are you, you know, coping with this? Not only being a nurse, but also, you know, having kids and family at home.
Yeah, you know, I talked to my spouse about this before, like when I first joined the team, if this was something he'd be comfortable with me doing. At the time we didn't have any kids, and so, you know, he told me if it was something I felt safe doing and I wanted to do, then he would support me. And we do have a child now, and this is the first time I've been activated, and he still supports me. You know, I do things at home to make sure he knows that I'm being protective of my family. So as soon as I get home, I take my scrubs off. If I feel like I've had high contact, I'll take a shower right away before I touch my daughter or anything like that. I've been trying to stay away from my family as much as I can, you know, just to keep them safe, and just be honest with them about, you know, what I'm doing and, you know, what it's like. But I think he trusts me as a healthcare professional, and he knows that I'm not going to do anything that would jeopardize my family, and so he just trusts me to do what I need to do.
It's something that I've just kind of, I guess, you know, I've done a lot of reading on this, especially some of the articles coming out about other health providers, and a lot of them, they're just kind of, you know, expecting to get COVID. They're just, it's more of a matter of when. Is that kind of your mindset?
You know, not for me. I guess I would say my goal is to not get sick. You know, both because I have a young child at home, and my home unit is pediatrics. I take care of transplant patients, and so that is my highest priority, is not to pass that along to anyone else, both in my family and my regular unit if I work over there. So I do as best as I can to do my PPE, and I follow all of our protocols so that I know that I'm doing everything I can to prevent it. I mean, that's what it's built for, and so I feel like if I do everything the way that I should be doing it and taking all the measures that I can, I mean, of course, obviously, you just never know, and there's always the option of, like, if I'm at the grocery store or something, I have, you know, I don't have my PPE there, so you just never know. But my goal and my hope is that I'm doing everything that I should be doing to keep myself and my family and my patients safe.
What is one thing that you're concerned about moving into this next week and the following weeks?
You know, I guess it kind of depends. I mean, there is a little bit. my family is really supportive, my immediate family, of what I'm doing, and my extended family. Sometimes I worry about if people were to find out what I do and not understand what I'm doing, you know, the fear of them being around me, and I don't want to make anybody feel unsafe. But again, I also take care of transplant patients, and so when I'm not on the biocontainment unit or on our floor, I just want to make sure that I'm doing everything I can to protect them, because really, I mean, they're the highest risk, you know, because they're all immunocompromised. And so that would be my greatest fear, is if I were to pass it along to someone like that.
And then I know you're busy, so I don't want to keep you too long, but so you guys just stop me whenever. But
no, you're fine.
Do you have what is something that you, I guess, have learned throughout this process and trying to be prepared for something of this magnitude?
You know, I'm continually amazed by the ability to make changes and roll with the punches on this unit, in both, I mean, really nationwide. We drill for this kind of stuff, we have for years. But I don't think anybody ever expected it would be something to this magnitude. But really, I mean, the whole team has just come together. You know, things change from day to day, you know, where we're using masks, we're not reusing masks, or, you know, things like that. We're changing where we use our PPE, how often how we're staffed, or things like that. And nobody really puts up any argument about it. It's just like, you know, we did this way yesterday, but today we're going to do it this way because we've learned more. We learn more, we know better now. And so it's just amazing how, and I mean, like, the floor is built from, they're pulled from all over the hospital. You know, we have transplant nurses, we have OB nurses, peds nurses, we have clinic nurses, OR nurses, we have, you know, everybody from all different backgrounds. And we all can come together and provide the same level of care, which is, I think, excellent, to these people, so that they can feel safe and hopefully make it home without COVID.
And then, you know, what would you say to the people and the public that maybe aren't following those guidelines and social distancing, and maybe they don't even take this seriously? Is this something that people should take seriously, and this is different than the flu? I mean,
yeah, so 100%. I would say, I mean, it's really hard to get it across to someone who just doesn't have any exposure to someone who's at risk. It's really easy for someone, you know, who knows somebody who's immunocompromised or elderly. They understand what's at stake. But for those who don't understand, they may, you know, they think it's written off. And of course, people who don't show large amount of symptoms, it doesn't seem like a big deal to them. But I would just say, you know, you would hate it. Does, even if you think it's dumb or you think it's over the top and excessive, I would say you don't want to be that one person who didn't follow the rules, and you could cost someone their life just because you know, wanted to run to Target an extra time, or, you know, wanted to go somewhere that you don't need to go. I mean, obviously there are things you're going to have to do, like get groceries and things like that, but it's really, if you can, I mean, I just can't stress enough, just because of the patients that I work with, I can't stress enough how important it is to really stay at home if you can.
And then, you know, anything else you'd like to add that, you know, maybe is, you know, important for people to know, or something that you noticed in the last week, increase at the hospital, anything like that?
I would just say, you know, I think people have been really rallying around this for the most part, and being supportive and following the guidelines that the government and healthcare workers have given. And I would just say, keep on, you know, make sure you wash your hands. There's lots of videos out there about, you know, how to wash your hands, how to use hand sanitizer. And I know there's been a big bump to buy those kinds of things, but really, you know, if you have them, use them. They're important. You know, don't just stock them in your basement and hoard them away. I would just, you know, just be aware of your surroundings and who you're around, because you just never know who you might run into and who you could be affecting. So I work on the inpatient floor, so everyone that's on our floor has already been tested. But I mean, the only people that as far as I know, now obviously things change a lot. But last that I had heard, the only people who are being tested are people who come through who are symptomatic enough to need hospital care, with either positive travel history or symptoms that could match COVID, and those are the ones being tested. So someone that, like, maybe me, who's, you know, in regular adulthood, has no underlying issues, even if I had symptoms, they would probably just tell me to stay home and quarantine, because we just don't have enough tests right now, and hopefully that'll change. But for right now, we really just need to make sure that until we have more tests available and can do more widespread testing, we need to make sure those that need the care get those tests.